Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
Hello everyone, I'm Pharmacist Michael, and today I'm going to talk about an interesting subject, and that is using psilocybin to treat depression and anxiety. And it's interesting because I had a pharmacist ask me what I felt about this just this week. I think after this video, you'll know how I feel about it. If you're interested in health and wellness, this is a good place for you to be, so be sure to subscribe. Can the psychoactive substance found in magic mushrooms be used to treat depression? Psilocybin is a hallucinogenic drug present in some species of mushrooms. This compound was utilized in the 1960s for various psychiatric conditions before being classified as a Schedule I substance by the FDA in 1970. Schedule I substances have no current acceptable medical use and have a high potential for abuse. Some examples of Schedule I substances are heroin, LSD, and PCP. Recently, some cities have decriminalized psilocybin. The first to do so was Denver, Colorado in May of 2019. The first state to legalize psilocybin is Oregon, where I live. Measure 109 passed in November of 2020. This measure allows the Oregon Health Authority to develop a program to enable licensed providers to administer mushrooms and fungi containing psilocybin to individuals over the age of 21. This measure opens the door for psilocybin to be used for psychiatric conditions where traditional treatment has failed. What is psilocybin? Well, psilocybin is a psychedelic substance that alters consciousness through interactions with serotonin receptors. The question is whether this substance has any benefit for these conditions. To answer this question, I looked at the available studies. Cancer patients commonly suffer from significant anxiety and depression. It is estimated that 30 to 40% of these patients are affected by these disorders when hospitalized. We know that anxiety and depression are associated with a variety of symptoms that lead to poor outcomes. Some of these include increased suicide rates, increased disability, poor medication compliance, and increased healthcare utilization, decreased quality of life, increased pain, decreased social functioning, decreased survival rates. Although this is a significant problem, no FDA-approved pharmacotherapies are approved for psychological distress related to cancer. Antidepressant agents take time to take effect. Side effects compromise treatment adherence. Many treatments are ineffective, and relapse rates are significant. A double-blind, placebo-controlled crossover trial involving 29 patients with cancer-related anxiety and depression was published in the Journal of Psychopharmacology in December of 2016. This study was designed to determine the efficacy of a single psilocybin dosing session compared to an active control, which was niacin, 250 milligrams, in treating cancer patients with anxiety and depression. The investigators concluded that moderate dose psilocybin, along with psychotherapy, produced rapid and sustained anxiolytic and antidepressant effects. These effects lasted anywhere from 7 weeks to 8 months. These patients exhibited decreased cancer-related existential distress, increased spiritual well-being, quality of life, and improved attitude towards death. There were no serious adverse effects reported during this study in either group. What about psilocybin in unipolar depression? Remember, there's two types of depression. There's bipolar depression and unipolar depression. So unipolar depression basically just means that the patient doesn't have bipolar disorder. An open label study of 12 patients with moderate to severe unipolar depression was published in 2016. This was a feasibility trial involving 6 men and 6 women. These patients received 2 oral doses of psilocybin, 10 milligrams and 25 milligrams, 7 days apart. This study's main objective was to create an optimized protocol for psilocybin administration and gain information about its efficacy in treating unipolar depression. No severe adverse effects occurred during this study, and the psilocybin was well tolerated. The side effects that did appear were anxiety, mostly mild, confusion or thought disorder, nausea, headache. No prolonged psychosis was observed in any of the subjects. Depression severity was measured using the Quick Inventory of Depressive Symptomatology, or QIDS. Every patient had a reduction in depression severity 1 week after the high-dose session. Week 2 showed the most significant results. 8 of the 12 patients, or 67%, achieved complete remission at week 1, and 5 of these, 42%, were still in remission at 3 months. Although this was a small study with a small sample size and no control group, it is promising that many of these treatment-resistant patients achieved remission of their depression. More studies are needed to confirm what was gleaned from this study, but it appears that psilocybin can be safely administered to patients who are appropriately screened and receive adequate support. Anxiety and depression are prevalent in today's society. Many of our traditional antidepressant medications take weeks to work and are often ineffective. Psilocybin shows promise in the management of those with treatment-resistant anxiety and depression. Psilocybin is also associated with only minor side effects. It does not typically cause compulsive drug-seeking behaviors and is relatively non-toxic. In addition to the studies I talked about in this video, psilocybin has also had positive effects on smoking cessation. It has also been shown to significantly decrease alcohol consumption in alcoholic patients. More studies need to be conducted to determine the optimal dose and frequency of psilocybin administration in treating psychiatric disorder. One thing is certain, we desperately need more treatments for anxiety and depression. If you have any questions or comments regarding psilocybin or any other medication or nutritional supplement, please feel free to email me at michael.brown@sunshinentc.com. If you've enjoyed this video, please give it a thumbs up and please subscribe to my channel for more happy, healthy living information. I'm Pharmacist Michael. Be happy and be healthy.